Hello and welcome to Project Planning 850A. My name is Dr. Brian Connor and I'm delighted to serve as your faculty mentor for this DNP project process. Um, First, let me tell you a little bit about myself and then we'll discuss briefly the course. Um, I have been a nurse for over 38 years. Spent many of my early years in ICU and critical care nursing, eventually moving into many different leadership roles, and eventually decided that I wanted to become a nurse educator, which I really felt like I spent a lot of time educating staff, colleagues, patients throughout my earlier career. So I've been teaching in academics and the collegiate setting for over 14 years. I have worked with well over 150 DNP students on their projects. So I'm very experienced in helping students achieve their goals of developing successful projects. Um, but I want to tell you that my most important philosophy is that I'm here to help you be successful. Yes, I may have a lot of experience, but you're the one doing the work here, and my job is to coach, mentor, guide, facilitate, do anything I can to help you be successful in this process, and I'm really committed to that. So I hope you understand and know that that'll be my goal all along. If and when there are issues to discuss or any problems, please know that it's always going to be in your best interest. If I tell you something that I think you need to change or do a little differently, it's nothing about you personally. It's about helping you be more successful, and that's really my main philosophy of teaching, but certainly of working with DNP students on their projects. Personally, I am married for over 39 years to my wife, who is also a nurse. We met in nursing school in 1980 in Fort Lauderdale, Florida, and been together ever since. We have two wonderful grown children and an amazing 9-year-old grandson. So basically now, as fully retired from our full-time jobs, my wife and I both enjoy teaching online and volunteering in our community, and I enjoy growing roses and tomatoes and playing a little golf now and then. So that's a little bit about me, and I look forward to learning a lot more about you as we move along this process. In terms of the course in this whole DNP project process, let me make a couple of things very clear. Number one, the whole idea of getting a Doctor of Nursing Practice, achieving a Doctor of Nursing Practice degree, is that you are able to demonstrate scholarly competency. So what do I mean by scholarly competency? It's one thing to be a really good nurse. It's one thing to be a really excellent nurse practitioner. But there's a little bit of a difference. There has to be a difference between achieving a master's degree in nursing and becoming a nurse practitioner, perhaps even being certified as an advanced practice registered nurse, versus becoming a doctor of nursing practice. The entire idea of doctoral studies, in my mind, revolves around the idea of scholarly work. Scholarly work. Nursing, let's face it, has been struggling for many, many years, and we're really beyond the struggle now. We're really doing excellent work in developing doctoral nurses, both at the PhD level and the DNP level. I personally hold a PhD in nursing, which means that I focused more on nursing research. So I'm not a clinical nurse practitioner. I was a clinical nurse and obviously a nurse leader, but not a clinical nurse practitioner. But what I excel in is research, evidence-based practice, and quality improvement. Those are the things I bring to you as a faculty mentor. So for your learning and education and really becoming an excellent doctor of nursing practice, it's vital that you achieve all the goals through this process of a Doctor of Nursing Practice project. Be thankful that you don't have to do a full dissertation, which is what we had to do as PhD students to achieve a Doctor of Philosophy in nursing research. One's not more difficult than the other, it's just different. And what I mean by that is becoming a nurse researcher didn't require me to do a lot more clinically, whereas you, as doctor of nursing practice students, are being required to achieve higher levels of nursing practice and being practitioners, and yet at the same time, now here we are requiring you to become scholars as well. Well, there's a reason for that. To achieve a doctoral degree, we have to make a distinction between master's prepared practitioners and then doctoral prepared practitioners. So many things will benefit you about achieving your final Doctor of Nursing Practice degree. Not only do you have the highest level degree possible as a nurse practitioner, but you also would be able to certainly serve in any academic institution as perhaps a faculty member, certainly at the highest levels these days of nursing, Doctor of Nursing Practice achievements are really looked on very well. So, and it's kind of nice, although can be confusing to patients if you say which I say I'm Dr. Brian Connor. Oh, are you a doctor? Yes, I'm a doctor of nursing practice, or I am not a doctor of nursing practice, but I am a doctor of nursing. Because I have a PhD in nursing. But you will certainly be able to say, yes, I'm a doctor of nursing practice. And that term is really taking hold throughout the country. And my firm belief is that nurse practitioners have just all kinds of opportunities. The sky's the limit on opportunities in this country to become and achieve more autonomy, higher levels of practice, and really the recognition that medical doctors also now certainly achieve. So, with all that being said, that's just some of my philosophies about this, but it really boils down to this whole course and actually this whole process. There are 6 8-week courses in the doctoral project process, and we'll go through those step by step. The good news is you don't have to do this by yourself. You see, my role is to be your faculty mentor, which means that I am your coach, your guide, your facilitator, sometimes your correctioner, somebody who needs to get you back online or keep you online or make sure you're going through the process that you need to go through. But I want you to understand that this is very rigorous. This is not something that can be taken lightly. It's not something that can be done easily in a short amount of time. There's no shortcuts. There are no ways to make this go faster or better or easier. It needs to be hard because doctoral work for centuries in all kinds of sciences has been extremely hard work. So for the PhDs, all kinds of scientists and educators and people in every field who have their PhDs have worked very hard to get their doctoral degree. It's also important that our Doctor of Nursing Practice students work very hard to achieve a doctoral degree. So those are my feelings. I don't want to spend too much time on the the content of this course because we're going to get into all of that. This is really my welcome message, introduction to our process, and to let you know that it's really important for you to obviously view all of the content in D2L, to review the syllabus, to make sure that you are understanding of what all needs to be done during this, especially first 8 weeks. I'm here to guide you, and please remember that when you have drafts of papers, drafts of your chapters and things, they're just that. They're drafts. And when I give you feedback, it's just feedback. It's not grading on how excellent it is or isn't. To me, this is a process, and you need to learn. And sometimes we learn by making mistakes or not doing things exactly the best way, and then you learn how to make it even better. So I'm here to help you make things better, not to criticize you or to tell you you've done things wrong, but just to help you constantly keep getting better, because that's my my goal. So I have wanted to say that I've also published with 3 or 4, I think, of my past DNP students. I've helped publish their work, and I'm listed as authors on some of their work. And it's always delightful when we can finish a project and perhaps get it published. I mean, that's a great goal. We understand not every DNP graduate is going to be able to publish their work, but it's always a wonderful goal to say, boy, I'd love to get this published and get it in a journal. So you're going to do journal reviews. You're going to see what so many other DNPs have done, as well as obviously physicians and others in the type of work that you want to get done. So, but just thinking about it as begin with the end in mind, the idea is, wow, wouldn't it be great to get this published someday, and then start your process, especially if you think about it going into academics. It's always a huge plus to be published in the work that you do. So I'm going to try to narrow it down from there and not go too much further now, but just to say welcome. I look forward to working with you. We're going to talk on the phone at least 3 times this semester or this term. We're going to be in constant communication. I'm going to look at all the discussions and respond to questions, and just help guide you through this process. It can be very scary, it can be very daunting, and believe me, it's going to take your time. But you have a team. Besides me as your faculty mentor, you're going to develop a project team, a DNP project team. You certainly will have to have a preceptor that will help you with your immersion hours, and we'll also have other committee members that will help you, or team members that will help you with this project, so you don't have to do it all alone. You'll get feedback from several people about how to improve this, and that's the great thing about achieving a doctoral degree, is it typically never has to be a singular endeavor, something that you do on your own. So I look forward to speaking with you and working with you throughout this whole semester, with the entire goal, this whole term, and throughout the whole process, with the whole goal of helping you achieve the highest levels you can achieve as a doctor of nursing practice student and eventual graduate, and being the best you can be. I always like to say that, I'm not getting any younger here, so eventually you or someone like you is going to be taking care of me or someone like me, and I want you to be the best you can be. So with that, I'll say goodbye for now, and we'll be in touch. So thanks very much for viewing this welcome video, and be sure to review the content, the syllabus, my welcome message that's written, and we'll be talking soon. Thank you.